Kieran McAnulty.
It's hard to take the government seriously when they claim that they are focused on health care of New Zealanders, when in the context of delivering this bill, the entire health system in this country remains underfunded. We have stories on a regular basis where people cannot get onto a waiting list, let alone through to see a specialist. And we have a situation like we have in Wairarapa, where they have literally stolen money that was going to be used for our hospital because they can't make their bills add up. They have such a hole in their budget because of their cuts that they have to take money from other hospitals to pay their bills. And then we have government members standing up and encouraging the House to support this bill, and they last for 30 seconds. How can New Zealanders take this government seriously when they talk about health? My colleague Peeni Henare summed our position up well. It might be that this bill will deliver benefits to New Zealanders, but in a very typical fashion of this government, they haven't given us substance or given us confidence that this bill will do what it says on the tin. It's possible that this might work, but it's also possible that it might not. It's a valid question to pose that is it possible to use the assessment processes of other countries and apply it here to streamline the approval of medication? Fair enough. But are the assessment criteria in other countries suitable for here? Are they as good as our processes here? We mustn't forget the role that the likes of MedSafe played during the pandemic. They were able, under extremely urgent circumstances, approve vaccines very quickly, given how important it was that they be able to provide the certainty that people needed to be able to have the COVID vaccine. We have stringent and effective processes that people trust in this country, and it is a valid question to pose, are the processes overseas as good as ours, and are automatically taking theirs, if there's two of them, to apply here, is that good enough? We want to explore that further, Mr Speaker, and that's why we're voting it to Select Committee, but that's all we're committing to. Because if the government doesn't front up and show us the substance that we need and the assurance that we need, and actually provides more of a contribution than we've seen from members so far, perhaps even better, Mr Speaker, the government members would, or the government, would demonstrate at the upcoming budget that they are going to properly fund health, that they are going to reverse the decisions that they've made that are directly linked to this bill. Let's not forget they got rid of free prescriptions. And here we stand up and they talk about improving access to medicines. Their comments on this bill and the way that they've framed this bill, Mr Speaker, needs to be looked at in the entire context of this government's attitude to health. People that need access to health care can't get it. People that can only get their prescriptions if it were free and now can't. This is the legacy so far of this government and the health. I still want to know what happened to Wairarapa Hospital's money. The minister is refusing to answer my questions. He's hiding behind public interest test, which frankly is appalling. They've got a lot to show us for us to trust them on health, Mr Speaker. Perhaps they'll do that at the committee stage.